बिस्मिल्लाहिर्रहमानिर्रहीम। ये हमारा सेकंड लेक्चर है लीगल प्रोसीजर में फॉरेंसिक मेडिसिन का। तो आज हम पढ़ेंगे मेडिकल प्रैक्टिस एंड एथिक्स। एथिक्स सेट अ मोरल प्रिंसिपल, कोड ऑफ कंडक्ट एंड गुड मैनर एंड civilized बिहेवियर। Four ethical principles are autonomy, respect for individual and his ability to make decision with regard to his own health and future action। ठीक है, आप किसी इंडिविजुअल को उसका रिस्पेक्ट दें, एबिलिटी दें कि वो अपना डिसीजन खुद ले अपने मुस्तकबिल के बारे में। बेनिफिशेंस एक्शन इंटेंड टू बेनिफिट पेशेंट एंड अदर। नॉन मेलेफिशेंस action intend not to harm or bring harm to the patient or other. Justice just to wider community in term consequence of an action. Ethics in medical practice. Important issue relating to medical practical are history taking, secret of patient, even most guarded one revealed to the physician. Medical examination, physical access to body, even private parts, manipulation. Medical treatment, administration of drug, poison, addictive drug surgeries. Personal secrecy, confidentiality, Hippocratic oath. Duty of RPM, registered medical practitioner, to protect confidentiality of a patient's secret. However, this duty privilege is not absolute, as a doctor may divulge secret in the interest of public. Qualified privilege, secret divulge is the interest of third party or interest of the community, either conformity with the law or on the order of court after recording protest. Privilege of communication, professional secrecy, privilege of communication, disclosure of patient information to agencies or personnel who qualify to receive it is having interest in it or interference into which the doctor has duty to disclose. Notification of birth, death or disease, industrial infection, contagious interest of community. आप ये काम कर सकते हैं सिर्फ इंटरेस्ट ऑफ कम्युनिटी के लिए। डिस्क्लोजर इन कोर्ट, refusal to disclose may result in contempt of court. प्रोफेशनल मिसकंडक्ट के ऊपर एक और लेक्चर भी है जो सेपरेटली आएगा। इफ इट इज shown that a medical man in a pursuit of his professional has done something with regard to which it would reasonably be regarded as a disgraceful or dishonorable by his professional breadth or good repute and competency, then it open to counsel to say that he has been guilty for infamous conduct of unprofessional respect. मिसकंडक्ट के बारे में एक लेक्चर आएगा। तो यहाँ पर ये बता रहे हैं कि अगर डिसऑनरेबल हो या डिस्ग्रेसफुल हो तो आपको कौंसल के सामने पेश किया जाएगा, जहाँ पर वो आपको गिल्टी करके आपका लाइसेंस भी सस्पेंड हो सकता है। समरी एथिक्स is the study of moral principle. Medical ethics revolve around the welfare of patient. Right and privilege of patient are to be respected. Secret of patient may be communicated to the authority who have the right to receive in large interest of community state. Any branch of moral principle on part of RMP may be expose him or to action by PMDC or civil court. Thank you for watching our video. If you like our lecture, subscribe our channel.